Hi, this is Harris Carmichael, and welcome to the pathology section for hematology and oncology. Over the next few slides, we'll review different ways that red blood cells appear on a smear. It's important to be able to visually recognize abnormal histology and link it to the correct diagnosis. These are often easy points, so don't be intimidated by long questions. Many of these questions will have giveaway clues that you should be on the lookout for. A good tip is to sometimes skip to the end of the question, read the last line first to find out exactly what they're asking for, and then go back up and read the rest of the question stem in its entirety. Let's try an example. A 4-year-old boy develops jaundice after taking TMP-SMX for a UTI. A blood smear shows these cells in abundance. What is the inheritance pattern of this child's disease? Well, if you know that degmocytes, also known as bite cells, are common in G6PD deficiency, and that these patients are particularly susceptible to sulfa drugs, then you're already halfway to the answer. Then the test will commonly ask inheritance patterns for these inheritable diseases. A good tip for these inheritance patterns is that diseases caused by mutations in an enzyme tend to be autosomal recessive, while diseases caused by mutations in structural proteins tend to be autosomal dominant. This is because if you have one allele for an enzyme that produces a defective product, you still have the other half of the enzymes to carry out the work. However, let's say you have a structural protein that is defective in your cell wall. Well, you can't overcome this defect by the other half of the proteins being normal, because you still got half of your proteins that are altering the structure of the cell wall. This is a great trick that can assist you in a question where you're unsure of the inheritance pattern, and you're really trying to decide between two options, autosomal dominant and autosomal recessive. Unfortunately, there is one catch to this wonderful trick. Diseases like G6PD deficiency are X-linked recessive, so in males it only takes one mutation to elicit the disease. Some of these questions may seem tricky at first, but they're all about their buzzwords and buzz pictures in red blood cell histology. Hematology is a classic place for these buzz pictures, and you'll find that lots of pictures here are really only seen in one disease state, so recognizing them will really help you ace your hem-onc section. These spiky cells are called acanthocytes and can be found in liver disease and A-beta lipoproteinemia, or simply cholesterol dysregulation. This is because abnormal lipoproteins build in the cell wall to forming that classic biconcave dish shape. Basophilic stippling is a pathologic RBC form that is most commonly associated with lead poisoning, sideroblastic anemias, and myelodysplastic syndromes. This cell is a schistocyte. Schistocytes are also sometimes called helmet cells because of their shape, and they are fragmented parts of RBCs that form in microangiopathic hemolytic diseases like DIC, HUS, and TTP. You might also see them in traumatic hemolysis, such as with a mechanical valve. Here's an example of a question incorporating the histology of these cells. A 24-year-old previously healthy woman in the final stages of labor suddenly becomes short of breath and has profuse blood loss per her vagina. A peripheral blood smear reveals these cells. What is the diagnosis? The schistocytes plus profuse blood loss in a woman in labor point to likely DIC. These fragmented cells are RBCs that try to squeeze past a thrombus in DIC and become schistocytes. Another important pathologic RBC variant is the target cell. Due to an increase in surface area to volume ratio, the normal area of central pallor is filled in with extramembrane, making the RBCs look like targets. Diseases in which you can see the target cells can be remembered with the mnemonic HALT when you reach the target. These stand for hemoglobin C disease, asplenia, liver disease, and thalassemias. And what is this last cell type? That's a sickle cell from a patient with sickle cell disease. These are examples of dacrocytes and echinocytes, better known as a teardrop cell on your left and a Burr cell on your right. What is the etiology of these two pathologic red blood cells? Well, the teardrop cell can be seen in bone marrow infiltration like myelofibrosis and is created as the cell is mechanically squeezed out of narrow spaces of the overrun bone marrow. People often use the mnemonic, "the bone marrow is crying," when thinking of these cells. And our Burr cell is a pathologic RBC that can be seen in liver disease, end-stage renal disease, and pyruvate kinase deficiency. As compared with our acanthocyte earlier, these spiky projections are more uniform and smaller. These are two hereditary pathologic RBC forms. Can you name each type? On your left is the elliptocyte, caused by mutations in the RBC membrane proteins like spectrin. And on your right is the spherocyte, which aside from the hereditary form, can be caused by drug and infection-induced hemolytic anemias. Heinz bodies are inclusions in RBCs that are composed of denatured hemoglobin. Heinz bodies are found in disease states where there is oxidative damage to hemoglobin, which includes alpha thalassemias, or more commonly tested G6PD deficiency. As a memory tool, I'm always reminded of Heinz 57 sauce, and so I can remember Heinz G6PD sauce instead of Heinz 57. Heinz bodies only show up after a crystal violet stain, which can be helpful to know because if the test question talks about doing this particular stain on a blood smear, then they can be hinting at the diagnosis. Do you remember the bite cells we spoke of earlier? Well, interestingly, Heinz bodies are actually very closely linked to these cells. The characteristic bite cell actually gets this shape because when the cell passes through the spleen, RBCs with Heinz bodies are bitten by splenic macrophages. The macrophage just tears off a piece of the cell that includes the Heinz body, and so it looks like there's been a bite taken out of the cell. I guess splenic macrophages must like Heinz G6PD sauce as much as I do. Howell-Jolly bodies are clusters of DNA found in some circulating RBCs and appear as basophilic nuclear remnants. During maturation in the bone marrow, RBCs typically expel their nuclei, but sometimes a little bit of DNA remnants can remain as a Howell-Jolly body. Since most people have normal spleens, these bodies get removed and are not usually seen on peripheral smears. However, if your spleen is dysfunctional or non-functional, maybe a patient with a splenectomy for example, Howell-Jolly bodies will remain. What prominent hematologic disease would cause a splenic pathology and thus display Howell-Jolly bodies? Well, a very important one for the exam would be sickle cell anemia. So to summarize, Howell-Jolly bodies don't necessarily indicate that something is wrong with your red blood cells, but it can be an indicator that something is wrong with your spleen.